Hi, my name is Aya Khalili. This is my ID that shows my name. This is also my audience. Today I would like to share what I know about smoking by providing you some information about the problems of smoking, what can you do to quit smoking once and for all, and how the smokers looks like. In order to have more information about the smoking, first let's talk about the problems of smoking or the effects in the human body. Effects in the respiratory system. There will be aeration in this area which is called the pharynx and the larynx. Smoking will also reduce lung functions by narrowing and swelling the airways of the lung. There will also be a permanent damage to the alveoli, which will cause a decrease in oxygen. Decrease in oxygen will also lead to decrease in blood pressure. Decrease in blood pressure will cause a circulatory problems. Effects on the circulatory system. There will be a rise in blood pressure and heart rate. Constriction, which is the process that tightening up the blood vessels that cause balance color of the finger and the stain on the skin. There will also be a damage to the lining arteries. You can notice here in this picture, this is the normal artery lining. This is the clogged artery, which you can notice in here. There's kind of swelling and functions in there. Musculoskeletal system effects. There will be reducing the bone density and tightening up the muscles over here. Effects of the immune system by lowering the levels of protective antioxidant in the blood. There will also be aeration of the stomach and intestines, reducing the ability to smell, to taste, and a higher risk of blindness and gum disease. Effects of smoking in the babies will result in low childbirth, in stillbirth, premature, and increase the risk of miscarriage. Now that you have known the effects of the smoking in the human body, now let's talk about what can you do to quit smoking once and for all. So you can quit smoking by using nicotine replacement therapy, which works by releasing nicotine into your bloodstream that will at much lower level of nicotine than the cigarette. This comes in different forms, which is nasal spray, body patches, tablets, gums, and any other forms. You can avoid using this therapy when you are pregnant because it's not really good for infants. Electronic cigarette, which is the device that you can trade the smokers of it contains a black or brown cylinder with the brown filters. It is the device that used to stimulate the experience of smoking, having cartridge with a heater that vaporized liquid nicotine instead of burning tobacco. Medication. One of the medication that called Zebra, which was originally designed to treat depression, but it was discovered that it helps to quit smoking also. This is prescribed as once to twice per day. It is used for 7 to 14 days before you can quit smoking. The other medication, which is called Champix, which is currently the only one that designed to help you quit smoking. It prevents nicotine from binding to the receptor, which reduces the effects of smoking side, such as feeling of depression and suicide thoughts. Now that you have a better understanding of what are the treatments of smoking, now let's talk about the appearance of smokers and how they look like. You can notice in here in this picture on the right side, this is the non-smoker's person, and on the left side, the smoker's person, which you can see a really big difference on the face emotions. Smoking will cause loose skin under the eyes. You can see in here in twin B, there is a loose skin under her eyes, while there's no loose skin in the twin A. Appear pale due to the oxygen and nutrient that smoking has. There will also cause a sagging skin, especially on the arms and under the breast of the human body. You can also see age spots. That's the effects of smoking. You can see age effects and black dots on the twin B, while we cannot see anything on the twin A. It will also cause a stained finger by this is actually due to the tobacco, and it will stain your fingers as well as your nails and the teeth. It will damage your teeth and gums. You can notice in here this is a yellowish color on the teeth. It will also cause a gum disease. Some smoker tends to lose their teeth earlier, while non-smokers keep them for a long time. There will be a deep lines under and around the lip due to the loss of elasticities. Smoking will also cause hair loss of women and men. Some people even go blind because they are smokes. It will also cause cataracts, which is the smoking that makes develop cataracts as you age. If these cause a serious problems, it can be treated with surgery. It will also do psoriasis on the skin, especially on the elbows, on the knees, on any other parts of the body. It could be white or red or silver. Today I have talked about the topic of smoking. It is my hope after this presentation that you will remember the basic information of smoking and why you could stop smoking, because it's obviously not good for your health and as well as your looks. With knowing this knowledge, I expect you at least to remember some information about smoking, like the effects of smoking in your human body, what can you do to quit smoking, and the appearance of smoking. Smoking is basically cause, so it is up to you to take the action of stop smoking or keep going. Thank you.